Welcome to the McLaren Bay Medical Foundation Report to Community virtual event. I'm Sarah Dandemoody, the chair of the foundation. I would like to introduce the presenting sponsors of today's event, Independent Bank and Weinlander Fitzhugh. First, from Weinlander Fitzhugh, we have partner and director of accounting and auditing services, Dave Quimby, who is also a foundation trustee and will assist us with introductions.
Thank you, Sarah. Weinlander Fitzhugh is proud to be a presenting sponsor and an ongoing supporter of the McLaren Bay Medical Foundation throughout the years. As a member of the foundation board, I'm happy to introduce my fellow board of trustees. Our officers include Chair Sarah Dandemoody, Vice Chair Pam Monaster, Treasurer Dave Quimby, Secretary Cindy Ferris, past Chair Ed Keating. Our current board of trustees are Ashley Anderson, Fadada Kiriate, Liana Bashad, Sally Bowden, Jenna Dost, Barb Engelhart Carter, Nancy Grieve, Rod Hildebrand, Joanna Keenan, Steve Kent, Rick Lyon, Lee Newton, Fran Santor, Spencer Skrupski, Dick Spence, Rich Steele, Mary Beth Taglauer, Ryan Tarrant, Matt Widener, and Bill Woolwine. It is a pleasure to work with a great group of hardworking community volunteers. And now I'd like to introduce the other presenting sponsor, who is from Independent Bank. He is a former trustee of McLaren Bay Medical Foundation, Market President Mike Stolak.
Thank you, Dave. To say 2020 was an unusual year is an understatement. However, McLaren Bay Medical Foundation has forged ahead with the help of hundreds of donors and community members. Independent Bank is proud to be among the many who have supported the hospital over the past year. As always, we plan to remain supportive of our community and our local hospital. I encourage everyone to do the same. Thank you for watching and learning about what our foundation has been up to this past year and what we are looking for in the future.
Thank you, Mike. As Mike has hinted, the theme that you will recognize throughout this program is the past, the present, and the future. The McLaren Bay Medical Foundation and our hospital, McLaren Bay Region, has a rich past, a vibrant present, and an exciting future. First, we will take a look at our past. The director of the McLaren Bay Medical Foundation, Lynn Weaver, and I will be sharing with you a little about the history and purpose of the foundation before we move ahead to discuss the present and future.
For over 40 years, McLaren Bay Medical Foundation, through wonderful donors like you, has been providing innovative technology, compassionate programs, and ongoing education to the patients and employees of McLaren Bay Region, all so our community can have quality care at the best value right here at home. This is our purpose, to support McLaren Bay Region and McLaren Bay Special Care. We are here to respond to the needs of our community, to make sure your hospital has the latest technology, to give employee scholarships for continued education, to provide comfort items for patients. And sometimes the greatest needs are to fill in the gaps, such as filling an unexpected need that was not part of the original budget. Every time you or a loved one comes to a McLaren Bay Region facility, chances are you are treated, diagnosed, or cared for with a piece of equipment or special supplies that were provided by McLaren Bay Medical Foundation. How do we do it? Through you, your time, talent, and gifts to the foundation, through your desire to make the community a better place.
The support from you and the foundation tends to fall into one of three categories: innovation, compassion, and education. Innovative equipment and technology are essential to stay on the cutting edge of care and service to our patients. For example, skylifts can safely change the position of sedated patients or move a critically ill patient from the bed to a chair, while Sarah's steady lifts can help patients at risk of falling get to the bathroom. Specially designed emergency transport stretchers and monitors securely and safely transport patients while their vital signs are continuously tracked. An automated chest compression system provides uninterrupted and consistent compressions, which help improve outcomes for cardiac arrest victims and improve procedures for medical responders. Facsetron Localizer is the latest technology that helps to identify the precise location of abnormal breast tissue for biopsy. It provides a much better patient experience, including a shorter overall procedure time. A variety of equipment, such as ultrasound machines and bladder scanners, is needed on an ongoing basis in order to provide patient diagnosis as quickly as possible. High-tech headlights for surgeons and illuminating vein finders for painless blood draws are smaller, important things that improve patient care. Specialized cleaning machinery for the facilities department provides quick and efficient floor maintenance. And the blue Staxi wheelchairs found throughout the hospital are used daily to transport patients and visitors that need assistance. Compassion is shown to our patients by providing care items and outreach. They include free mammograms for those in need, bike helmets for community youth, breast cancer pillows for women following mastectomies, beauty and healing aids for cancer patients, warming cabinets that heat blankets for comfort, and art therapy items for patients dealing with mental health issues. In addition, over 100 AEDs, automated external defibrillators, have been gifted to local schools and nonprofit organizations. Education is another important area that the foundation invests in. Examples include funding for employee courses that vary from new strategies to provide safe and effective care for people with mental health disorders to certification in emergency neurological life support. Since 2004, $211,000 in scholarships have been given to McLaren employees to advance their education in nursing and allied health. And since 2011, over $237,000 has been given in our Education Assistance Program for medical students. As Benjamin Franklin said, an investment in knowledge pays the best interest. In reality, every gift given through the foundation to the hospital is a true investment, an investment in the present and future, an investment that will result in quality care at the best value right here at home. In the past, donors to the McLaren Bay Medical Foundation have invested in very large projects to secure our futures. In 2004, over $4 million was raised to establish the Helen M. Nicholas Volunteer Clinic, which provides primary health care to the uninsured. $2 million from the foundation was invested in the Karmanos Cancer Institute at McLaren Bay Region, so local residents can receive high-quality cancer treatment in their own community. To be able to provide the best in local mental health treatment, our donors invested $578,500 to improve and expand the behavioral health unit at McLaren Bay Region. These campaigns were all responses to community healthcare needs. We have done it in the past, and with the incredible support of our donors, we will continue to do it into the future. Over the past 40+ years, millions of dollars have been distributed through the foundation to meet the needs of your hospital. And every single dollar given has stayed local and always will. Because of the selfless efforts of community members in our organization's history, today McLaren Bay Region is a strong, viable community hospital that continues to do what is best. Because of our rich past and vibrant present, we are able to look forward to a healthy future. That future is made possible by the work of so many during the last several decades. Today, we are highlighting an individual who began planning over 40 years ago to ensure the health of our community. He is a founding member of the McLaren Bay Medical Foundation, a major fundraiser for the hospital, and our longest-serving trustee on the foundation board. He has given an abundance of his time and resources to guarantee our community has a local hospital that provides quality care for the best value. We feel it's important to recognize and honor this gentleman's legacy of passion and commitment, and we are proud to introduce Guy Timmins Moulthrop as the first recipient of the Guy T. Moulthrop Philanthropy Award.
Good afternoon. On behalf of our family, I'd like to congratulate my dad on receiving this well-deserved recognition this afternoon. Everybody in our family knew growing up that my dad was always involved in the community. It was probably later on in life when the awards and recognitions started to come in that we really understood the extent of his giving and community service. When I came back to Bay City to join MCI, one of the first things my dad did was called me into the office and said, make a list of the community organizations you're going to be involved in. And at that time I kind of questioned, why? But that mentoring really established my future with community service. I also remember asking my father, why don't we spend more money on advertising at MCI? And he looked at me and he said, why spend the money on advertising when you can invest in the community? Dad set the culture of giving and volunteering in the community before I even joined the firm, and it is still the culture of MCI today. Again, I would like to, on behalf of the family, congratulate Dad on this well-deserved award recognition this afternoon, and thank him for his mentoring, everything he's done for the community, and all the guidance he's given his family over the years. Thank you.
Well, in 1975, Tim Moulthrop and I were co-chairman of the Community Gifts Division of the campaign to finance a replacement for the aging and obsolete General Hospital. It was really a delight and a privilege to work with Tim. And because of his efforts, which were a major reason, we exceeded the campaign goal by over $700,000. Tim's insurance and business acumen, his hospitality towards others, philanthropy, volunteerism, quite frankly, are legendary. And Bay City is a far better community in which to live because of him. My respect and admiration for Tim have been reinforced exponentially over these many years. As far as I'm concerned, if only we could clone him. Thank you.
It's been an honor and privilege to get to know Tim and to work with Tim over the years. Back in 2004, Tim and I co-chaired the capital campaign for the volunteer clinic for the Hospital Foundation. When Tim and I started the campaign, we had a goal of $3.9 million. In 20 months, we raised a little over about $4.2 million. I look fondly back on our Tuesday meetings. We met for 20 months, maybe 24 months, every Tuesday at 8 or 8:30. It all depended what if Tim or I got there at 8 or 8:30. But we met for about 2.5, 3 hours on the detail of the campaign, and it was that detail, that commitment, that I learned of how to move forward, how to make a capital campaign, and Tim was just very generous with his time. Tim's just been a wonderful mentor to me and to so many in this community. Tim recently retired off the Bay Medical Foundation's board. He is the longest serving member of that board, so quite an accomplishment, quite an achievement. Tim, I'd like to thank you. I'd like to thank you for not only all that you've done for me, but I'd like to thank you for what you've done for our community in making it a better place.
I first met Tim in 1985 when I interviewed for the position of director. Tim was on the committee with 4 others, and at that time he was serving as chairman of the foundation board. Tim was the go-to person. He had the history of the organization, including the merger between the small hospitals, finally the creation of Bay Medical Center, and then all the work that the foundation did in order to support Bay Health Systems, Bay Medical Center, the other corporations that came to be, hospice and so on. Tim was a kind of the historian of the foundation through the years, but he also was very gentle in terms of reminding people why we existed, what we were here for, and he was a very good donor, he and his wife Jane. Tim, I just want to say to you, congratulations. This is a well-deserved recognition and honor, and I couldn't be more happy to express my gratitude and thanks to you on behalf of myself, my family, and our community. Thank you so much.
You know, our community is really truly blessed. It has a number of men and women who work very hard to make this community and keep this community to be safe, a great place to live, to work, to raise a family, and to just enjoy life. And Tim Moulthrop is one of those people. If you work with Tim on a project, you better be listening to him. You better be ready to get moving, because he has done his homework. He is laser focused on the outcome. He knows what the success will look like, and he's ready to go to work. And you'll take your cue from him, because he sets the tone, the pace, and the objectives for you. So we are in a great debt to Tim and what he's done for this community, and we admire him so.
I'm proud to be here today. If you look at my hands here right now and see what this award offers, it's all because of an individual that we're talking to. Tim, we couldn't do what it is that we do without individuals like yourself. You have been a pillar in our community. You have been someone that has truly made a difference. If you look at what individuals have done, if you look at, when I look at myself and say, what is it that I want to do? What is it that I want to leave behind? It is that legacy. This is something that you have done. Individuals like you are what every community needs, and because of you, I'm proud to be here today. This award for you is something that gives me deep pride, honor, and I'm extremely pleased to be here today to say thank you for everything that you've done to not only give us this, but if you read it, it's the Guy T. Moulthrop 2021 award that will be here forever. Thank you and congratulations.
Thank you very much. It's really a very, very nice honor to get this. And I think you have to remember, however, that no matter who gets these awards, there are other people involved in the work that they do. And rather than to try to name some of them and then miss some, I'm not going to name any, but there are a lot of people that deserve these awards too, and they do the work very quietly. I had an advantage because my insurance agency insured the hospitals, and we knew how bad the hospital problems were, and the fact that they were under the gun, and I think it was the State Department of Public Health I'm not sure what the actual name is, that was threatening to shut down both Mercy and General type of thing. So when it got to that point, they were looking for all kinds of people to help, and it was decided that we had to go out and raise the money and build a brand new hospital rather than try to retrofit a 70, 80-year-old building. And we started out, we were going to have a fundraising period for 1 year and then take a look at it and decide whether we were going to do any more than that. And the first year was so gratifying, and we raised money so easily that we threw out the original plan and went right ahead with the second and third year and raised the money in actually 2 years. The original, I think, the original goal was about $250,000, somewhere around there, I think. I could be wrong. And of course, we raised $4.5 million. Well, I think it's terribly important to those that have no access to any kind of medical help. And I keep telling myself how lucky I am and my family is that we have insurance and we're able to go to the hospital when we got a problem. I can't conceive of being in a position where you're sick and you know you can't go to the hospital. But I do also know that Bay Med will take anybody that walks through that door if they're sick. I know that to be a fact. And I hope most people understand that. When you look at Bay City, it's around, Bay County I should say, is around 100,000 people. It hasn't changed really in my lifetime, to speak of it, not much. To me, when you look at building Bay Med, the main hospital, you look at Helen Nicholas, you look at Delta College, you look at SVSU, it's amazing how much money has come out of this community and how much money there really is. So I would encourage anyone here listening to this to put the hospital right at the top of their giving list. And I know that everybody has a list of people and organizations they give to every year, but you can't do any better than to give to your local hospital, which is obviously Bay Med. Clarence, thank you very much for this award. It's very much appreciated, and I will treasure it. And keep up the good work. You're a valuable asset to this community, and we need you, and hopefully the foundation will do its part to help make life a little easier. Thank you again.
We are so thankful for all Tim has done to make the McLaren Bay Medical Foundation what it is today. At this time, I'd like to take a moment to honor those trustees we lost this year. Bob Dimitroff and Paul Bigick both gave many years of service. We are grateful for their leadership, commitment, and dedication to the McLaren Bay Medical Foundation. They will truly be missed by us and the entire community.
One thing that certainly stands out from this past year is that it has been most demanding for all of us. Under normal circumstances, it is challenging to keep a hospital functioning smoothly 24/7. But during an unprecedented pandemic, you can multiply those challenges by 100. Through it all, you, our donors and community members, have been there alongside the doctors, nurses, respiratory therapists, patient care aides, housekeepers, dietitians, case managers, and the multitude of others who are necessary to provide quality health care within our hospital. With an incredible need for personal protection equipment, such as masks, hand sanitizer, face shields, and ultraviolet disinfectant units, we have had hundreds of donors give to the Foundation's Emergency Response Fund. Your gifts made a tremendous difference. Not only did you help keep patients safe, you provided for the well-being of staff as well. And let me tell you, the staff appreciate all your help. We know people are curious about how the COVID-19 crisis affected our hospital. How were the medical staff able to respond? What did it take? What changes were needed? And how did they make it through? Well, the McLaren staff were incredible. The bulk of the physician care of COVID-19 patients fell to our hospitalist team, which is led by Dr. Libby Pionk. Here to tell you about the experiences of her team and how your donor dollars made a difference, we have the Director of McLaren Bay Hospitalist Services, Dr. Pionk, to tell you herself.
Thank you. I have the opportunity of being the director of the Hospitalist Service, which is an awesome group of individuals and doctors that I love working with, and I love what we do and the team that we have at McLaren Bay. And you may ask what exactly is a hospitalist and what we do at McLaren Bay. And really what we are is your personal on-site doctor that coordinates care between specialists, surgical specialists, or other specialists such as cardiologists, gastroenterologists, your care as the patient with your primary care provider. And we're on site 24 hours of the day. We have a day service as well as a night service, and our team works together to provide continual care to you while you're hospitalized at McLaren Bay Region. Because we're on site 24 hours of the day, 7 days of the week, we were really positioned to provide care when the COVID pandemic occurred. And we were challenged and graciously accepted the challenge of providing care to COVID-19 patients at McLaren Bay Region. It was very difficult treating patients for COVID-19 in that we didn't have a lot of knowledge regarding the disease, whether that be treatment and really early on testing. We didn't have accessibility to testing with quick turnarounds. As you may remember, testing was initially going first to the CDC in Georgia, then to the state of Michigan, and then finally we were able to do testing at McLaren Bay Region once the technology caught up with the disease state and what was happening. So we provided care to patients who were diagnosed with COVID-19 in the intensive care units with our pulmonologists, as well as on the cardiac telemetry floor. And it was challenging in treating patients with such an aggressive disease. I know that it was challenging as well for our nursing staff and respiratory therapists, as well as our specialists and colleagues. We saw a lot of people, unfortunately, die from COVID-19. We saw some people who became very ill from COVID-19 and still have lasting effects from the disease. And we saw people be discharged home or discharged to rehabilitation after being diagnosed with COVID-19. And those really were our success stories. And we were happy and grateful to participate in the care of all patients that came to McLaren Bay Region looking for help after experiencing symptoms or after being diagnosed with COVID. Really, it was with the help of the community that we were able to have appropriate personal protection equipment to provide the care. It was essential, really. We would go into COVID rooms that required us to put on gloves into each room and gowns. We also had masks, regular surgical masks, as well as N95s, disposable stethoscopes in each room, and really all of that equipment was exchanged between rooms, between going in and out of those rooms. So that was essential to provide safe care to patients, and it also to be able to be in the hospital and not exposing others to the virus. By our team providing COVID-19 care to patients, we really got to participate in a lot of educational opportunities. Obviously, we're still learning things about COVID-19, whether that be treatment, diagnostics, and that was really a continuum over the previous year of participating in education, obtaining recommendations from McLaren Healthcare, and being able to provide that to our patient population. Being on site 24/7 really was important for the COVID-19 patient population at McLaren. Obviously, as you know, patients were very ill, and we took pride in being able to provide care to them at the bedside whenever they needed additional treatment or another evaluation. We were happy to provide that care. It was challenging in that it was sad to see many cases, and it was hard, I know, on nursing staff. It was hard on our team as well. But sticking together, knowing that we had the support of the community was essential, and we appreciate that. And it was emotionally hard on nursing staff, respiratory therapy, our team, but I can guarantee you that if another wave is to come again, that our hospitalist service will be here to take care of patients, be able to be here to take care of the community, just as you took care of us. And we appreciate you.
Thank you, Dr. Pionk, and thank you again to you, the foundation donors, as well as the incredible community members who gave their love through donated snacks and meals, handmade face masks, as well as signs thanking healthcare workers, and the thousands of hearts decorating windows and walls throughout our community. You may know that the foundation also manages the hospital's robust volunteer program, which had to be put on hold when the pandemic started. However, some projects were able to safely use volunteers. One vital program saw volunteers helping to make sure plastic isolation gowns were available amidst a severe shortage. We were able to find a supply of gowns made by a Michigan plastics company who managed to create rolls of plastic gowns. The big rolls held 200 gowns each, which needed to be separated, then folded and stacked into bins to be distributed to the various hospital units. Hundreds of volunteers over several months assisted in this massive effort, which resulted in tens of thousands of gowns. Without their help, the safety of the staff and patients could have been compromised. We cannot thank them enough.
During this past year, our donors also gave to the Heartstrings campaign for a new and expanded cardiac telemetry system that will allow for cardiac events to be caught quickly. This will literally save lives. The state-of-the-art equipment will monitor the heartbeat of patients every minute they're in the hospital, providing the best possible care. Telemetry is important for so many reasons. Dr. Nicholas Mawad is here to tell you about the impact of your donations and our expanded telemetry system. And just in case you're not aware, he will tell you about McLaren Bay Region's outstanding heart program. If you or a loved one has cardiac issues, you are definitely in good hands right here at home. I'm pleased to introduce Dr. Nicholas Mawad, Chief of Vascular and Endovascular Surgery at McLaren Bay Region.
Thank you so much, Sarah, for that kind introduction. I'm really happy to be here today to talk about our telemetry campaign and our vascular and heart program at McLaren Bay Region. What is telemetry? Well, in short, it's our eyes and ears to make sure we follow your heart 24 hours a day. It allows us to know early detection of any problems with your heart, such as a heart attack or an irregular heartbeat. It also allows us to detect any discomfort you may have from a heart or vascular program. Importantly as well, during COVID-19, it allows us to be other places taking care of the many sick patients we see at McLaren Bay Region while focusing on your heart as well, because the monitor takes care of that for us. And most importantly, it should give you peace of mind, understanding that we're following your heart 24 hours a day, even if a provider is not by your bed. We know what's happening to you and your heart health. At McLaren Bay Region, we have a premier cardiovascular program, or a heart and vascular program. We do a lot of heart surgery, a lot of complex surgery, managing your aorta for aneurysms, for stroke with blockages in your neck, and for blockages in your legs that can lead to gangrene, which is known as peripheral arterial disease. With your generous donation, we now have 144 telemetry beds, 32 more because of this telemetry campaign. I could not thank you enough, because it allows us to really take care of these patients in our community, patients like you all that really need the best care possible. And at McLaren Bay Region, we are a premier flagship program. We do a lot of very complex surgery and also very community-based type surgeries instead of having to go to some other facility far away from your loved ones. We want to keep this care all at home. I understand that you all may be worried and scared, particularly to be in the hospital because of COVID-19, but unfortunately, your heart health doesn't wait. COVID-19 and your heart health don't wait. So don't delay care. We are more than happy to take care of you here at McLaren Bay Region, and I just cannot thank you enough as a surgeon for all your donations and your belief in us and giving us this opportunity and support to be able to manage us and your patients closer to home.
Thank you, Dr. Mawad, and thank you again to our donors who made our telemetry and emergency response campaigns a big success and resulted in making our hospital and community a better place. But so much more happened during the past year, and our President and CEO, Clarence Civilian, is here to give us highlights of those accomplishments and challenges. Clarence will also share his thoughts on what your community hospital may look like in the future and what it may need.
Well, hello. You know, in the times of when there are challenges, there's always times that blessings come out of them and always opportunities. 2020, 2021, wow. You know, it certainly has been a time of, certainly a time of challenges for our community. I want to start by just saying, first of all, a thank you. You know, those blessings are each of our donors, our community, our staffs, our physician, providers. You know, no other time have I ever seen a group come together to say I've identified a need, I've identified those challenges with COVID and more resources that are needed. Difficult times, but at the same time, seeing a collective group come together, it certainly gives you a certain amount of pride of where you are, the importance of who you are, why we got into healthcare. The things that really resonates with you, and you know, you can almost, you know, you get chills in your body of saying, you know, this is why I do what I do. 2020 and 2021 certainly presented that list of challenges. You know, we saw, you know, the COVID, you know, here within our community, at our hospital, the ups and the downs, March of last year of 2020, all the way up to the most recent surge that we've had and are having as well. Having to adjust, having to, you know, navigate through that, having to work with our teams. It's certainly something that, you know, where we have opportunity, you know, a lot of those blessings certainly came through with that. We've had a changing healthcare environment. We've seen, you know, where I believe personally that healthcare has changed forever. I think that it's something that, you know, we are going to have to adjust to, you know, whether it be folks that have overutilized healthcare and the healthcare system, to those that have more of a need, those that need a better way of access. We're having to respond to that. We're going to respond to that. And that's where all the opportunities come in. That's where us having to respond and looking at where our community needs are. And when we look at not just the, you know, the objective things that we put out from a survey standpoint, but as we're hearing, listening to what some of the needs are in our community, we're responding to that. And we will certainly continue to do that. With that being said, you know, this year where we have had all those challenges, we've had a lot of opportunities. We've took that time to really go back and look at, you know, what were some of the needs that we've had. We certainly knew that we needed to do some upgrades to our facility. That infrastructure, some things that, you know, is not the most recent service offering or not the most recent, you know, big thing that would, you know, have bells and whistles on it. But at the same time, we've understood that, you know, who we are and the root of who we are and the basis of who we are, we knew we needed to make some improvements to our facility. So we've invested a lot of opportunity this year and took the time to say we wanted to invest in redoing all of our patient rooms, giving it a refresh, and understanding that we have a number of our community members that come into our facility and we owe it to them to be able to give back to our community. And so we spent a this whole year really looking at revamping our 6th floor, our 5th floor, going to our 3rd floor, eventually getting to the entire 4th floor as well as of a total refresh. New beds that we've added to our facility, all exciting things. Things that are not so, things that you think about, but are very necessary for the perception in the community of who we are, like redoing our parking lots and making sure that, from a community awareness, a perception standpoint for our staff and our team who also see that on a day-to-day basis, and our patients. Doing our parking lots, doing the things like our chillers, our boilers, an important thing to our facility of our elevators. We were able to do that this year and make the necessary improvements there as well. Again, things that didn't seem so, wow, bright and fancy, but were very necessary for our ongoing operation and our ongoing commitment to our area and our community. Then we do get to some of those more exciting things that truly impact it. When I say the patient care from an equipment standpoint, we were able to do all of our new defibrillators within the entire organization. Some of the things from our telemetry, thank you so very much for the upgrades and what we're continuing to do there. Our MRI, and redoing, not only our mobile but our fixed MRI units as well. And our new linear accelerator, the completion of our West Branch project, creating better access for our community as well, and the need that we have there. All exciting things that we were able to accomplish and perform this year was outstanding. We could not have done that. We could not have done that without the support of you, meaning our community, you, meaning our donors, and our team that pulled together to make all those things happen. All great things and fancy things that are out there, but why are we into healthcare? We're into healthcare to make a difference, and our continue, I guess, go and strive towards excellence, and that is the quality of care that we provide. We've received a number of awards this year. We've gotten through our Joint Commission accreditation, which no conditional findings, which is significant, meaning that we're a quality care organization, meet the requirements of CMS, and able to provide that service to our community, something that we take great pride in. When we look at our maternity ward and being one of the only in the state of Michigan of excellence on that as well through health grades, that's something that's extremely valuable to our community and to the moms and families that we care for on a day-to-day basis. The number of cardiac awards that we've received this year, our enhancement of Leapfrog, and all things that we're making improvements on a day-to-day basis is why we're in healthcare. We created a patient safety dashboard looking at our mortalities, morbidities, harm events, and how we're seeing steady improvements in each of those categories. That warms my heart because we're moving the dial on that, because at the end of the day, I know and we know we're giving better patient care to our communities. Wow, putting all those things together is significant, and again, I try to tie in. I always say I like to connect the dots. Connecting the dots is what it is that we're doing. Again, back to our community, back to our teams, and obviously the continued support that we're going to need. So what's in the future? what's going to be the next thing? I wish I could say I knew right on the spot. It used to be we could do a 3-year strategic plan. Well, it's almost a 3-day strategic plan now because of the changing environment. Us being responsive to that, us being having the ability to be flexible and understanding and listening to all those sorts of things. We're doing that. As an example, when we talk about behavioral medicine, always is one of the things that are out there, and mental health. Whether it be through PTSD, through the COVID crisis, or the increasing demand that we're having to, because families have been affected, or, the opioid crisis. What are we doing in our community to be able to address that? Well, I can share with you, and one of the things that I know that we'll be doing on a go-forward basis is addressing that need, that concern. Not only on the inpatient side, when we talk about dealing or partnering and having programs available for our geriatric population, but our normal adult population. Looking at how do we get into pediatrics, and then transitioning that into some substance abuse, and also some of the things that we want to do on the outpatient side of things as well. Again, creating better access and having an avenue for our community to know that they have somewhere to go. We want to be that pillar. We want to be that foundation and that go-to place for folks and individuals to say, you know what, McLaren Bay Region, that's where I want to go. That's our goal. That's where we're going to continue to strive towards, something that we certainly want to enhance. When we talk about we look at Bay County, we look at Our demographics, where we're going. We know we have an aging community. Our 65 plus category is something that has not only been identified out there, but how are we responding to it? What are some of the programs that we need to have in place to further enhance the services that we have? So when we look at our cardiac care and our cardiology space of what we're going to do of bringing on new providers, new service offering, we look at structural heart programs and the investment that we're going to make into those categories and areas, absolutely. Is something that we want to emphasize and not only on the provider side, but the technology side. Telemetry is an example of something that we've had a need for, and we want to enhance and be able to provide for every patient that comes through our door, or have the ability at least to do that. Oncology space, we've made a significant investment not only on the medical oncology space, but also on our radiation oncology side of things. How are we looking at programmatic things now? And how do we enhance that? Again, from a provider standpoint, a service offering standpoint, all things that are critically important to what our community has asked for, but more importantly is a need. How do we create that access point is something that we most certainly have to do, and we'll keep our finger on the pulse of having to do. So stay tuned on some of those other things that we'll bring forward with enhancement of those services through our partnership with Carmanos. Something that's extremely important to us, and the service offerings that we bring will be something that is going to be ideal. Certainly things that is our core and the basis of what we're wanting to do. When we talk about women's health, is something that we know. I told you about the awards that we received. How do we enhance that and have more of a focus of some of the most important individuals and the decision makers of our household? How do we put our arms around the women's health service line to say, these are the types of things that we know we need to do, whether it be in the cardiology, mammography, breast care, or pediatrics. Those are all things that we know are critical and are part of our core service line here that we're going to enhance. So we're going to be investing in technology, providers, service line offerings to be able to address that concern as well in the upcoming months. And you can't never lose sight of your orthopedics. The need for additional, when we look at robotics and when we look at service line offerings around orthopedics and the greater good and the care that we're going to have for possibly looking at hand care and other things are things that are critical. So the advancement and the only way that we were able to get there is by, listening and talking to not only our providers that are on the outpatient side in the hospital itself, but our community as well. And if you blend all those things together, and you say, okay, what additional things can we do to provide that support? Is truly going to be around how do we look at not only those service lines and what we're going to do there, but how do we create, decrease the barriers that we have when we talk about social determinants and working with our healthcare partners and other facility partners of looking at, grocery stores in the right place and transportation that is going to be able to assist in greater access, but taking it a step further of how do we use technology to our advantage, and that is through our telehealth platform and virtual health and those sorts of things. Again, is healthcare changing? Absolutely. Is it something to be excited about? Absolutely. But the most important thing is, and by doing all those things, and I'll conclude, I know I've talked quite a bit to summarize it all, is that the only way that we're able to do all those sorts of things, the only way that we're able to bring those things together, sure, we can get in the room and have strategic planning sessions, we can talk about things that we need to do, is the action items that we bring together and make sure that we're doing it. But guess how we do it? We do it through you. We do it through our partners. We do it through our team. We do it through our donors. And I can't say that, I couldn't be more excited to be a part of a community that really has embraced and continues to embrace what it is that McLaren Bay stands for and our McLaren Bay Medical Foundation stands for. And the support that we have had and we're going to continue to look for is something that we're going to not only count on, but need as we move forward. So, I'm just happy to be here. I'm happy to share all the good, exciting things that I think I see us doing and developing and responding to. But it's never a better time to be in healthcare because there's never a better need right now. And our ability to respond to that, our ability to react to that, but our ability to work together as a team through everyone that is here today and is listening, again, it puts a smile on my face. And I can only say thank you. Thank you. I appreciate everything that our community does, continues to do, and I just can't say thank you enough.
Thank you, Clarence. In closing, we want you to know that we are planning for the future healthcare needs of our community. We are making sure we can take care of you for many years to come. And of course, we're going to do it together with all of you. We are a community that cares. On behalf of the Foundation Board, staff, and volunteers, thank you for what you have done and will do.
We've all been working hard, working together to try and support our colleagues as they provide the best care for our patients during this difficult time. And through this time, the Foundation has been with us every step of the way, supporting us not only with financial grants and equipment that we need to give the best care for our patients, but also keeping our spirits up, our morale up with the things that they do for us every day. So thanks to the Foundation, and thank you to all the donors who have given so unselfishly to help us out. We appreciate you.
Because of you, we've been able to offer programs that support and educate families from pregnancy and beyond, like Boot Camp for New Dads that helps prepare expectant dads for the joys and the challenges of fatherhood. Thank you for protecting our new babies with all your support as well as their families.
Hello. I would like to thank the community for all the support that they've shown us over the past year of the pandemic. Thank you to everybody who donated to the Emergency Response Fund last summer. Helped us get a lot of PPE for ourselves, got our masks and everything. Thank you to all the small businesses that kept us fed during our long shifts. And thank you to the rest of the community for all your thoughts and prayers.
Thank you so much for all of the help and aid that you've provided us at McLaren Bay Region. The personal protection equipment that was afforded to us to be able to provide care to our patients was essential. Thank you for your time, your thoughts, and your generosity.
Thank you. I'd like to thank our community and all communities for their support, for their donations, and most of all, your love. It's very well appreciated. Thank you so much.
Thank you so much.
Thank you for your continued support.
Thank you.